The Mental Health Act, Act 846, is to provide a comprehensive framework to address matters relating to mental health care delivery in the country. Mental health care was left out of the Millennium Development Goals, and experts have argued that the omission was a big oversight as mental health cuts across all the goals. To this end, accessibility of quality mental health care has now been recognized by the World Health Assembly in its declaration of May 2013, enjoining all member states to plan for mental health. In Ghana, access to mental health care is on the low side. The country can boast of only 3 mental health institutions, namely the Accra Psychiatric Hospital, Ankafo and the Pantine Hospital. This has resulted in a centralized mental health care delivery system where people from up north depend on the south to access mental health care. This has resulted in congestion in the 3 centralized institutions.
If the court brings a patient to us for us to attend to, because at the point of conviction they realize the person has a mental illness and therefore cannot stand trial, they bring him to us for us to treat. After treating, we send a report back to the court that this patient is well enough, please come for him. And often we have challenges in their coming for them. They also have their own genuine challenges. Sometimes they say the patient, the prosecutor has been transferred and is no longer there, or they don't have a vehicle to come for the person. Various reasons, legitimate they are. But the fact remains that it makes the patient remain unduly at the hospital for too long, and that is a violation of their rights.
Currently, there are 11 practicing psychiatrists in the public sector, 1,500 mental health nurses, 3 clinical psychologists, 14 medical assistants, and 250 community health officers across the country, a situation which falls far below what is expected as a nation. The alternative is to seek the services of traditional healers and spiritualists, most of whom lack the expertise for taming patients with mental disorders. The acting CEO of the Ghana Mental Health Authority, Dr. Kwesi Osei, says mental health care delivery in the country leaves much to be desired.
The current set of mental health care now, for which the law is coming to address, is that we have a poor quality kind of mental health care. And if you ask me to quantify, I'll say on a scale of 10, 10 being very good, 1 being very poor, we are probably hovering around 2 to 3.
The Door of Hope, thus the Mental Health Act. The Act encompasses all aspects of mental health delivery. Stakeholders have deliberated on the recommendations of the Act, which spells out the need for a mental health authority, funding for mental health, public awareness, and the responsibilities of caregivers and the state. For now, it is hoped that within the next 5 years, the Mental Health Act, Act 846, will improve mental health care delivery in the country.